Welcome back. I'm Dr. Russo. Welcome to my YouTube channel. One of the big questions that people and even nurses and providers always ask is, when should I start neurotoxins and fillers? And by neurotoxins, we mean Botox and Jeuveau, Dysport, and all the things that you've probably heard about. And the answer is it depends, right? So there's no exact age, like when you're 27 and 3 months, you have to start neurotoxin and fillers. But it's really more about what people are trying to accomplish. And for example, my daughter, when she was in her 20s, started developing very, very deep lines of her forehead, just because that's her anatomy. So she started doing Botox in her 20s. Other people get to 40 and 50, and they don't have any lines on their forehead, right? So it's part of it is really just the difference between people and their anatomy. But generally speaking, when people have lines at rest, so when you animate, you have lines, and when you stop animating, usually you don't have lines, but if you're old like me, you still have lines at rest, or even some young people have them. That's an indication that the lines are getting so deep that you definitely need treatment with neurotoxin and possibly even fillers. But we'll stick with neurotoxins for now. So now, the people who are coming to us are different. When I was first starting in practice, and I'm 30 years into it now, people always got old and then tried to look young, and that's really hard. But now patients are coming to us at a much earlier stage, primarily because of social media and Zooming and staying home in COVID and all the things that we know about, but I don't want to talk about anymore. I'm just exhausted from talking about COVID. But they've come to us and thought to themselves, hey, I don't want to look older. I look at myself on Zoom and I see I've got a double chin, or my nose is bigger than I want, or my lips are a little bit smaller, or whatever. So now they're coming to us at a point in time where they first identify a problem and they want to treat it. So in my mind, prevention is so much easier than trying to, trying to correct, right? Prevention is way easier than correction. And I imagine a time when people won't even need surgery anymore, right? I don't think it's that far in the future, because I know that when I first started 30 years ago, the only thing I could offer people was surgery or no surgery. And now people are going through life, for 30, 40, 50, 60 years and not needing any surgery, because we've got so many new things and new tools and new technologies that can prevent it. Fillers is a different thing. Fillers is about volume loss. So as we get older, we lose bone, we lose subcutaneous fat, our muscles start to atrophy as our testosterone levels start to drop, and the skin itself thins out as we start to lose collagen, elastin, hyaluronic acid. So everything's deflating essentially. So people, in my mind, start deflating earlier than most people realize. Like if you look at someone in their 20s who looks beautiful and youthful, then see them again 10 years later when they're in their 30s, you will see a significant volume loss, particularly in women, particularly in the medial part of the cheeks. So I think aging occurs even in the 30s. So if someone comes in at that age, it's very, very easy to correct them with very small amounts of product, because their skin is elastic. They don't have a lot of bony loss. They don't have a lot of subcutaneous fat loss, but they have some. So it's very easy to correct. As you get older, it gets much harder to correct all those losses with just filler. And sometimes you need other things, and sometimes you need surgery. So that's the issue, how to start. It really depends on the patient. When the patient starts to notice something that bothers them, that's the way to do it. That's the time to interact with them and explain how it works and talk to them about prevention. But it can work at all ages. So don't worry so much about an exact number. Talk to the patient, understand what bothers them, and talk to them about being preventative and being proactive, and they'll probably live a very long life and may not need surgery at all. So remember, subscribe to us on YouTube, follow us on Instagram. And if you're a nurse just getting started or want to come into aesthetics, click on the link below and find out more about our school, the Aesthetic Mentor, and how we can help you.